Welcome to Nova Careers, Levi. Thank you for being on here. Can you introduce yourself and tell us what you do for a living?
Yeah, my name is Levi Crook. I'm a physical therapist, and a lot of what I do on a day-to-day basis is just rehabilitation for patients who either are post-surgery, post-injury, or are just wanting to improve their functional mobility and their strength. Balance are a lot of the big things that we deal with on a day to day basis. With physical therapy, there's a lot of different settings. I personally focus more on the orthopedic setting, which tends to be outpatient. So, a lot of my job, I work in the outpatient setting as opposed to in a hospital setting where I'm on a hospital floor working with patients who are more acutely sick.
Okay, so outpatient is like, I know you said rehabilitative stuff. Is that more the outpatient?
Yes, yeah. So most of the time when a patient, let's say, goes in for surgery, they're going to be referred by their surgeon to a physical therapy clinic. And that sometimes will be attached to a hospital, but the majority of the times it's not even directly inside a hospital. It can be a freestanding building just inside your community. In my case, it just so happens that the outpatient clinic that I work in is also attached to a hospital. And my job is actually very unique because when I have a patient that maybe had a conflicting appointment and is unable to make their appointment, or if I just don't have a slot that's filled up with a patient, I'll actually float up to the acute side of physical therapy and see patients on the hospital floor who are more acutely sick with, and that can range from all sorts of issues, cardiopulmonary, GI, it really can be anything. So,
You said cardiopulmonary. Do you do some sort of physical therapy for that?
yeah. So, the biggest difference between physical therapy inside of a hospital versus on the outpatient side is really our goal. So, in the acute care hospital, our primary goal is to make sure that this patient who is admitted because of a certain diagnosis or a disease, when they're medically cleared to go back home, that they are safe to do so. For example, with cardiopulmonary conditions, they may have heart issues or respiratory issues that no longer make it to where they are safe to go home on their own. And so a lot of my job is just either rehabbing them on the hospital side so that they can safely go home. And if they're not able to make a full recovery, I'll recommend that they go to kind of an in between hospital, which is called an inpatient rehab. And that's where they'll get further therapy in order to make sure that they can go home. The outpatient side is mostly patients that medically are stable. They don't have any issues that really are going to necessitate like a hospitalist who would oversee certain medical diseases, conditions that necessitate 24/7 care by the hospital staff.
Okay. All right. So then what does your normal day look like if there's a normal day? What does that look
Yes,
like?
yeah. That's the beauty. That's actually a big reason why I chose physical therapy is because there really isn't a normal day. And so usually what I do is I show up, it's around 7:30 in the morning and I do a lot of chart review. I look through the medical charts of the patients that are coming into the clinic. If it's an evaluation, I try and understand why they're coming in. So I go through all their previous hospital visits and try and get an idea of what they're coming in for, whether it's an acute shoulder pain, whether it's chronic low back pain, whether it's post surgery. I try and get an idea. So the first 30 minutes of my day, I do as much chart review as I can. For those patients of mine that I'm going to do a treatment for, I just kind of run through what we did the last visit and then kind of set a goal in my mind of what I want them to be able to do during today's visit. And I'm always trying to progress them because that's where we're making progress towards whatever their goals are. Throughout the day, I see patients in the outpatient clinic that are scheduled. In my clinic, they arrive every hour. Some other clinics, you'll have them arrive every 30 minutes. So it really depends on the type of outpatient clinic you're at. The hospital I work at is non for profit. So we get to spend a little more time with our patients because time is not of essence. Because with physical therapy, you make money based on the hour. And so a lot of other clinics, they'll try and get as many patients through the door as they can to make as much money as possible.
Yeah.
So for me, I see 7 to 8 patients a day. And The diagnoses range from post surgery, like knee replacements, rotator cuff repairs, ACL repairs, to some more chronic disease conditions like chronic low back pain, balance impairments, and even just like a few, I don't get as many in the outpatient setting, but a few neuro conditions like strokes,
Mhm.
Parkinson's disease, things like that.
Okay. Yeah, that makes sense. So do you work on all of the areas of the body? Like if someone had elbow issue or, I mean, you already said knee. So do you
Yes.
cover the whole body?
Yes, yeah, we do. Pretty much head to toe. We cover certain clinics in the physical therapy industry can focus more on specialized areas. So there are some, especially outpatient clinics that will pretty much only see post-op patients. So
Okay.
there's a couple surgeons that specifically will refer their post-op patients to them. And in those settings, those therapists can tend to focus on, hey, I'm going to be the shoulder therapist. I'm going to get really, really good at rehabbing the shoulder post op. And another physical therapist will become kind of the knee guy or the hip guy or the low back guy. But the beauty of where I work is it's kind of anything and everything walks through our door. And that's what I really like because everything I learned in PT school, I'm applying on a day to day basis. I'm not really losing any of those skills. It's definitely a little more challenging because sometimes there'll be patient diagnoses that you haven't seen before. You've only studied about them in school, or maybe you haven't even studied about them in school, and you kind of have to hit the books again. You'll dig into the research, and I love that because you never stop learning. In order to be the best healthcare provider, you constantly have to be learning and staying active on what the research says, what the clinical practice guidelines say. So
Gotcha. So definitely no 2 days look the same for you.
that's for sure. Yeah, absolutely. And even on a month to month basis, it tends to change because with physical therapy, we'll get a patient and we'll see them for about a month to a month and a half before they're ready to discharge. And so you'll kind of notice a pattern. There'll be a wave of patients. And so really it changes even on a month to month basis because as you discharge a bunch of patients that have now gotten better, you're getting newer patients that are kind of having to start all over. So it makes it very interesting to me because it's very different on a day to day, week to week, and month to month basis.
Gotcha. Yeah, that makes sense that you would have to, and like you said, you have to go back and study up or brush up or look up how you're going to treat a patient if someone comes in that you haven't either learned about or you haven't dealt with in a while. So that's good. It keeps it fresh, huh?
Absolutely. And that was a big thing for me when I was looking at careers, both in high school, but also later on when I was switching careers in college. I decided that I really wanted something that wasn't the same 9 to 5 job where I was sitting at a desk doing the same thing over and over and over. Because at the end of the day, I wanted something that was going to be fulfilling and satisfy my need to be working for something that could impact people. And yeah, physical therapy has given me that purpose.
So how did you get into this career field?
Yeah, so that goes actually all the way back to high school in a sense. I originally didn't even want to go to college. I hated school. I hated high school so much. I hated studying. It didn't feel like I was learning anything that would be useful for the rest of my life because I was like, how is learning about pre-calculus going to impact my day-to-day activities as a functioning adult in society? And I just wanted to join the military and be a fighter pilot. And my parents strongly encouraged me to go to college. And so I applied for some scholarships. I got a good scholarship to a school that was well known for its aviation program. And I actually went for a full semester there studying to become a pilot. And I decided it was not for me because I recognized that when you're in a cockpit and you're sitting right next to one person, the ability to make an impact on people's lives is very limited because all
Mm,
the people that I really wanted to be able to interact with were in the back, locked behind a door. And while it was good to talk with like a co-pilot or the senior captain. It just wasn't satisfying that desire to be helping people. And in a sense, I would have been helping them as a pilot. Not to say that you can't help people in that career field, but I really wanted that one to one interaction with people. And so I really had no idea what else I wanted to do because my heart had just been set on becoming a pilot. And So it was a winter break, about 4 weeks, and I had to make a decision what my new career would be. And so I
Pivot quick.
was yes, very quick. Yeah. And I was scouring the internet. My parents were encouraging me to take personality tests that would kind of suggest different careers that might suit you based on your personality. And I took a test and it kind of suggested like an engineer, an architect. It suggested a physical therapist, a nurse. And so I started just kind of learning about those different careers. I talked to people that I knew who were engineers or architects or physical therapists. And one of my good friends from high school was actually just starting PT school at the time. And so I was able to shadow him at the clinic and I talked with him. And based on what he was saying, I was like, this sounds like a really good career choice for me. And so I switched my degree then to kinesiology, which is kind of the stepping stone to physical therapy. And yeah, and the rest is kind of history.
So you said that kinesiology is the stepping stone. Is that how is that? What does that entail?
Yes. Yeah. So with physical therapy, and it's really ironic coming from me because I was the one who said I didn't even want to go to college. Physical therapy is a graduate level degree. So with physical therapy, it takes 4 years of a bachelor's degree to study kinesiology, to study exercise physiology. You kind of want your bachelor's degree to be something related to human body, human movement, because that's going to set a really good foundation for you when you go to PT school. So after your 4 years of undergrad, and you graduate, you can apply your senior year for physical therapy school.
Okay.
And the way it works is you have to have a competitive resume, a competitive application. So, what that typically looks like is you're going to have a lot of observation hours in different settings. So, you want to get observation hours in acute care physical therapy, in an inpatient rehabilitation hospital, in an outpatient PT clinic, and you want to get a good amount of hours, number one, for yourself, because if you're deciding to make the time and financial investment in yourself going back to school, you want to make sure that it's going to be a good fit for you.
Right.
4 years of undergrad already is a big time commitment, a big
Right.
financial commitment. And if you're deciding to go back to school, you want to make sure that it's a good fit. And so by getting a lot of observation hours, you're exposing yourself to everything that physical therapy entails. And while even if you decide not to do physical therapy, you've spent that time to make sure that it was not a good fit for you. But if you were like me, as you were doing the observation hours and you're like, yes, this is so cool. I want to learn as much as I can, that gives you a pretty good idea. You should probably make that financial and time commitment to invest in yourself and invest in a career that will be satisfying for you. And so they look at observation hours, they look at GPA, and they also look at things like community service, extracurricular activities, sports, just anything that kind of tells them what makes you you and why you're a good fit. So you apply, you're going to have an interview if they like what they see on your resume. And then if you interview well, you'll get accepted into PT school. It's very competitive. Most cohorts, so every year with physical therapy schools, and there were only a few in Texas where I applied. There's going to be like 20 to 40 students, depending on the size of the school, that they accept every year.
Oh,
And
wow.
so I had some people who were also applying at the same time, and they didn't get accepted their first round. But the biggest thing that I think helped was that they were so invested in it and they knew that they wanted to do this career that they just waited, applied a second year, and they got in that time. So
Wow.
yeah,
Yeah, I
but
didn't realize that.
yeah, so and then with physical therapy school, it's somewhere between 2.5 to 3 extra years. It's a doctor of physical therapy that you graduate with. So you spend your entire studies just focusing on the human body, the movement of the human body, the rehabilitation of the human body.
Okay. Wow. So what is observation hours? Is that kind of like an internship type situation or what is that?
Yeah, it can really take many forms. It can be an internship in my junior year of undergrad. So, my junior year studying kinesiology, I did an internship where we had to get X amount of hours. I can't really remember how many. but they wanted us to get those. So I got some of my observation hours that way. Some of it was just me reaching out to different clinics, different hospitals, going and talking to physical therapists I knew and asking if I could shadow. And most of the time, they're going to have you sign some paperwork, like a HIPAA form, because it's patient confidentiality. And then you just show up and you observe, you just watch. And that's a really good idea. That'll give you a really good idea of what it looks like to be a physical therapist, the good, the bad, and the ugly. You'll see the patients that do really, really well, and you'll see the patients that are struggling to get back to where they were prior to an injury or prior to a surgery. And then you also see that, physical therapy is not always direct patient care. We have to document what we do so that insurance will reimburse us. And that can take a little bit. And that's always sometimes one of the things that turn people off is they're like, I don't really like the documentation. I like working with people and I like helping them exercise and helping them achieve their goals, but I don't like the documentation. So the observation really gives you a really good idea. But you can also work as a what I also did is when I was really committed to physical therapy, I just worked as a physical therapy technician. So I was getting paid to get hours. And all that we do as a physical therapy technician is help patients with their exercises because that's a skill level that we qualify for as we're working through like kinesiology or undergraduate. So
Okay. So as an assistant, is that what you said?
Mhm.
That
Yeah,
would
it's
be
called so a physical therapy assistant is actually, that's an associate's degree you can get.
okay.
So most of the time, if you're and you also have to apply to be a PTA or a physical therapy assistant. It's another competitive program. It's a little easier to get into than physical therapy school. It's also shorter. It's an associate's degree. And that can actually, I'll take a side step there and talk about that. With physical therapy assistant school, it's an associate's degree, but you can also go back to school after working as a PTA for 2 years and you can go back to school and become a DPT, a doctor of physical therapy. So they have bridge schools. There's not as many, but they do exist and they're a lot more flexible because they recognize that you probably have a full-time job as a PTA and they recognize that you have a lot of experience as that sets you up to be a really good doctor of physical therapy. And so that's where they it's another 2.5 years in your bridge. Sometimes the bridge schools are 3 years as well, but that's another option. Instead of doing 4 years of undergrad, getting a bachelor's degree, you could work towards your associate degree as a physical therapy assistant, work for 2 years minimum, and then apply to PT school for a bridge program. So that's another option as far as getting to become a physical therapist.
Gotcha. So in your job, you were talking about that it sounds like you're not only just working with the person to get them to do those exercises, but you also have a lot of paperwork and documenting that you need to do as well.
Yes, and I would say it's a ton for each patient. So, for example, I'll just break it down for an evaluation. The first time I'm seeing a patient, the majority of the session, I would say somewhere between 40 to 45 minutes, I'm just evaluating. I'm doing hands on tests. I'm trying to diagnose what is causing their pain, their movement dysfunction, whatever it is they're coming for. I'm trying to diagnose that and develop a treatment plan.
Okay.
So an evaluation tends to be a lot longer. And then I spend the remaining 15 minutes trying to document all of my findings so that when I submit that to insurance, insurance can see why we are requesting that insurance pay for physical therapy.
Okay.
And so I spend maybe a little bit more time than the average person documenting because I want to give my patients the best shot at
Right.
getting insurance to cover rehab.
Mm.
And so, as far as an evaluation, that's kind of what it looks like. For a treatment, it's much easier because we already have established a game plan. We've already diagnosed. So, most of the time, what they do is they come in, we might start warming them up for 5 minutes, just getting their heart rate up, getting their blood flowing, preparing them for whatever we're about to do. And then we jump into a hands on treatment that lasts pretty much the full hour.
Okay.
As we're going, I'll kind of make some notes in their medical records as far as, hey, today we were able to do 3 sets of 15 at 20 pounds for, shoulder overhead press or something like that. And that the next time I come through or one of my physical therapy assistants come through, they can see what we did last time and progress it further the next time.
Okay.
So with the treatment, it's a much more abbreviated version of documentation. And sometimes that's why people want to be a PTA and not a DPT, is because all they do is treatment. So all they do is the hands on stuff. They don't have
Yeah.
to document as much, but you really become very efficient at documenting. Sure, there'll be some harder, more complex patients that really require you to sit down and maybe take 20 to 30 minutes to type out the note. And again, that's just me. I feel like I spend a little bit longer than the average person, but I really want to give my patients the best shot. And also, if someone else further down the road is seeing the patient for the same condition, whether it's a primary care physician, whether it's the orthopedic surgeon, they can reference my notes and see exactly what my thinking was as far as what was causing this patient's pain or movement dysfunction. So that is one of the things that a lot of people don't realize about physical therapy is there is the documentation side, and that's something that might turn you off if you do not feel like you want to type notes like that. Maybe physical therapy assistant would be better. There's still going to be just some documentation, but it's not as in depth.
Okay. Yeah, well, that leads into a good question that I usually ask. So, what sort of a person would be good at as a physical therapist?
Yeah. So I think someone who goes into physical therapy needs to be good at critical thinking and problem solving. And you kind of have to like that. That's what I love about my job. When a patient comes in that I've never seen before, I love that because I get to be the first person to start peeling back the layers of the onion to figure out what's at the center that's causing their pain, that's causing their movement dysfunction, that's causing their inability to do everyday activities. So, critical thinking and problem solving is key. I think another really important skill for a physical therapist is interpersonal skills. So, being able to empathize with your patient, to be able to communicate clearly, to be able to relate to them on things not even related to what they're coming in. One of the things I love about my job is working with older patients who have so much life experience.
Mm,
And I get to kind of interview them, much like you're doing for me right
yeah.
now, and learn from their life experiences as they're doing their exercise or as they're holding their stretch for 60 seconds. I get to talk to them about their life experiences, or I get to hear about their grandkids, or I get to hear about their desire to compete at a collegiate or professional level, whatever it may be, because it's not like we just work with older patients. So, interpersonal skills is really important because you need to be able to communicate. Physical therapy is just as much the physical, human body, human movement, human performance aspect, as well as the therapy.
Hmm.
We're rehabilitating the physical and to a degree, sometimes the emotional side of each patient because injury surgeries they come with a certain degree of emotion. You injure yourself at the peak of your season and you're sitting out for the rest of the season while all your teammates are playing, they're getting scouted, whatever it is, and that has an emotional component that you as a therapist need to be able to recognize.
Hmm.
Sometimes they're so scared about re-injuring themselves, and you need to understand that while yes, they may physically be able to return to play, you might not be mentally there, and you have to then figure out how do I accommodate that? How do I help them overcome this mental, emotional barrier? Because physically they're good to go.
Right.
So, yeah, I would say critical thinking, problem solving, interpersonal skills. And then you got to be good with your hands. So much of my job is hands-on. I'm working with patients. There was something we studied in PT school. It was this article that looked at two different types of physical therapy treatment. So two groups. One group just received exercises and stretches that were prescribed by their physical therapist. And so they showed up twice a week
Right.
and they underwent that type of treatment. The second group had the same exact thing, same stretches, same exercises, same therapist. But throughout the visit, the therapist would just lay a hand on them at one point. And the group that got better was the ones that had a therapist just touch them at one point. And I think that illustrates perfectly why being hands-on is so important with our patients and
Right.
is such a key component of physical therapy.
Yeah, and that makes sense. What you said about therapy, because I was thinking that as you were even talking about it, I was like, well, you're kind of, it sounds like you're kind of a therapist, which that is in the title.
Yes.
But yeah, I can see that where you would have to be on the emotional level as well as, not just working with them. And I've seen it on Instagram and things where I can pull up something, do this for your whatever, your back, whatever. Not really the same as going into someone who's going to really show you that you're doing that move right, but also that, talk you through it and really try to dig into what's causing that pain. So, and I can see that you love your job, that you really
Do. Yeah,
you really
I
do enjoy
really
your
do.
job.
I'm so glad I didn't become a pilot because I would be doing this job.
Yeah, you definitely wouldn't be talking to as many people. So,
Yeah.
is that what you wanted to be when you were in high school? Was a pilot? Was that what you always wanted to be?
Yes, yeah, yeah. In high school, all I wanted to do was fly airplanes, and I still love flying. And I recognized after a couple of weeks of flight training that more the commercial side that I didn't enjoy. I didn't enjoy the prospect of being gone a lot. I didn't enjoy the prospect of being, basically sitting in a seat in front of a joystick. Planes practically fly themselves these days. So
Right.
when I was in high school, what really drew me to that was it sounded like a very hands-on, each day was not the same, but the reality was your cockpit is basically like working a 9 to 5 job at a desk. You're still sitting all day. You do get to see different places. You're always traveling, but yeah. So I learned very quickly that while aviation was a cool hobby and something I enjoyed doing in my free time, it was not something I'd want to do as a career. And I always grew up playing sports, loved human performance, athletics. I loved all of that. And so physical therapy was very much building off of another component of my passions and my hobbies from high school. I just didn't recognize that that would be a good career, mostly because I didn't even realize it was a thing. And the funny thing is, my older sister went to PT multiple times for issues. She was a very good ballet dancer, and I knew of physical therapy, but I didn't really know what they did. And so that's the beauty of what you're doing is you're just exposing people to career paths and career opportunities. So,
Right. And I think that's true that we, go to different businesses all day long and we don't realize the different jobs that are behind that one business. So, yeah,
yeah.
that's why I'm here.
Yes.
I think you kind of covered, well, maybe I should ask you anyway. Your
Sure.
favorite part of your job.
I think the favorite part of my job, I really enjoy, I'll say this, I really enjoy the hands on component. I love working with my hands, whether it's soft tissue work, whether it's dry needling, whether it's cupping, whether it's joint mobilizations, manipulations. There's so many things I do with my hands. And I love that so much. I love working with my hands. But what I enjoy even more than that is seeing, sometimes in a very small way, sometimes in a bigger, more drastic way, someone's quality of life improve. Oftentimes when my patient comes in my clinic for the first time and they're dealing with whatever it is they're dealing with, they're a very different person from the day they leave. Because when they're coming in, they're afraid, they're in pain, they're uncertain, they're scared. They're not sure if they're going to be able to live the rest of their life the way they used to before their injury, before their surgery. And a lot of what we do is just improving their quality of life, whether it's small or large, because sometimes we can't heal every patient, but we can help improve their quality of life even in a little bit, whether that's decreasing their pain just a little bit, whether that's allowing them to walk just a little further, whether that's making them feel like they're not going to fall as frequently, whatever it is. That's what makes it such a rewarding career, and that's what I love the most is seeing the difference in people and then getting to know them through that whole process as well. So I kind of gave you like three answers. I like working with my hands, I like helping improve people's quality of life, and I like just hearing their story and getting to know them.
Yeah. I can see that you're very outgoing and you enjoy just talking to people and developing that relationship. Very relational with your patients, so it's not just an exchange of doctor patient.
Yeah, and that is actually another big reason why I chose physical therapy is I looked at becoming a physician's assistant, an orthopedic surgeon. I looked at a lot of different things when I was kind of in between careers. And the thing that discouraged me from that was just the sheer amount of patients you see as a orthopedic surgeon, a primary care physician, an MD. You're seeing Sometimes it's a patient every 15 minutes. Sometimes it's
Mhm.
even more than that. But you simply do not have the time to engage with them and build that relationship. Uh,
Yeah,
so
that makes sense. Definitely. Well, I appreciate you coming on here and explaining what you do as a physical therapist. And I have a few rapid fire questions for you.
let's do it.
I'm going to
Yes.
try to do them rapidly. So,
Okay.
first job you ever had?
Lawn care.
Lawn care. Okay. Was it your own or you worked for someone?
It was my own. It wasn't like I didn't have an LLC or anything. But yeah, I mowed mostly just the neighborhood lawns growing up.
That's a good job to do.
Yes. Yeah.
What's one career you wouldn't want to do?
Aviation. I know that.
Now you know that.
I
Okay.
know that, and I learned by my mistakes. Yep.
But it didn't take you long to learn, so that's good. You're a quick
Fortunately,
learner.
yes. Fortunately, yes.
All right. Coffee, tea, or neither?
Coffee. I
Do you
love
drink
coffee.
coffee? Yeah.
Oh, yeah. Yep, I
Okay.
love coffee.
Same, same. And then what's one piece of advice you would give your teenage self?
It's a really good question. I'm trying to think because yeah, I wanna give good advice because I know other people hear this, but as you're looking at setting goals for your future, do things for yourself, not just because someone on social media told you to do it, not just because a family member told you to do it, not just because you think it looks cool or it would make the most money. Do whatever you're doing because you want to do it, because at the end of the day, that's what really matters is doing something, whether it's being a father, a husband, a physical therapist, do it because that's something that you want to do, not just because society tells you to do it. Because in today's day and age, we're exposed to so many things on social media and we're told so many things to be so many different things. But when you strip it all away, most of that doesn't matter. And what really matters is listening to what 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 your heart is telling. It sounds really cheesy, but like listening to what your heart is telling you to do, like your gut feel.
Mhm.
And it might not make you the most money. It might not be something that'll give you a whole lot of recognition or status, but if it's what matters to you, then pursue that with everything you got. I'll share this too. There was a quote that I read in high school that was really informative too for me. And it said, choose a job you love and you'll never have to work a day in your life. And that's what I feel I'm doing right now.
Yeah. It definitely sounds like that's what you're doing because I can plainly hear that you love what you're doing and that it doesn't sound like work. It sounds like it's very fulfilling for you. So
Yes. Yeah.
thank you, Levi, again for being on here and sharing your story with us and how you became a physical therapist. I know it's going to encourage someone. So
Yeah. I'm
thank you.
happy to. Yeah. It took someone else exposing me to physical therapy to get into this career. So I'm just hoping I can pay that forward.